And I wanted to call this morning to sort of prepare people for what I believe is going to be a report today at noon on new cases that will be the largest that we've reported to date. And I wanted to sort of try to give some context to that. Nationally, in fact, there were a lot of stories yesterday about this. Nationally, private labs just got overwhelmed, and they just didn't have the capacity to run the tests and get the reports out timely. And as a result, tests were just backed up. And so we've had a backlog here as well. In fact, I think there were 160,000 tests backlogged at the Quest. Similar stories coming out of LabCorp. And as we see them ramp up their throughput capacity, the logjam is breaking. And so we're getting many more tests informing our daily reports now. And that's certainly been the case the last 2 days, but we're going to have a huge spike today is our very best guess when we report at noon. And so I just wanted to call and tell people that across the state of Louisiana, we expect that at noon we're going to have the largest number of new cases that we've reported. And some of these will be relatively recently diagnosed cases, but the vast majority of them are going to be tests that have been done over a number of days. And the vast majority of these patients will have already been told a couple of days ago, 3 days ago, 4 days ago that they have COVID-19. Most of them are not in the hospital. They've been sent home to isolate. And so I just wanted to make sure that you all know that we're ramping up here in Louisiana to do everything we can to expand testing. But as more and more labs come online, getting them to timely report that information to the state so that we can report it both to CDC and to the public, it's been hard, but we're ironing out those processes, and things are getting better every day. But what we know, Newell, is that mitigation does work, and social distancing works. The stay-at-home order is imperative. We're going to extend that through the month of April. We'll do that by a new proclamation issued today or tomorrow. And by the way, we're getting pretty good compliance, quite frankly, in New Orleans and Jefferson and Baton Rouge and Bossier. But there are large parts of the state where, quite frankly, we are not, and people, quite frankly, just need to do better. And so that's why I wanted to come on this morning. And then there's some more context to this, Newell, that I want to share with you and the listeners. So we've had an abnormally high death rate, and what we're now knowing is as these tests come online, these results get reported, we just have a lot more COVID-19 than we previously thought. And it is also true that we have a population that is on average sicker than that in most states, and sicker on those underlying chronic health conditions that predispose people to be most vulnerable to this virus and to this disease, principally diabetes, kidney disease, heart disease, obesity. These are by far the four leading health conditions that cause people to be more susceptible to this virus. So that's what I wanted to report to the people of Louisiana. The numbers today are going to be jarring, and I just wanted to kind of prepare people, put it into context. Oddly enough, Newell, the modelers, the scientists who model COVID-19 and the mathematicians, the statisticians and so forth who model this, they don't use new cases principally to model what's happening in a given population. They use the number of people in the hospital and the number of people who die, because different reports say different things, but sometimes 10%, 25%, some reports say 50% of the people with the virus are asymptomatic. And so they're not being tested, although to some degree we know that they can spread the disease. And so it's not necessarily new positive test results that drive the modeling. What we have a much better handle on in terms of being accurate are the number of people presenting to hospitals with COVID-19 and the number of people who die. And from that, they can extrapolate how many people in the population actually have it. And that's what's driving our modeling, not just here, but around the country as well.